A hospital in the OPD examination room. An elderly woman is waiting to see a doctor. Today I know the disease.
Hello, what's your name?
I'm Randy Sansuk.
How old are you?
I'm 65 years old.
What are your symptoms?
I have occasional back pain and cracks in my legs, difficulty passing urine, nausea, and vomiting, but in the urine and not excretion for 2 days.
How long have you been feeling like this?
I have been like this for 1 week.
Do you have any underlying disease?
I have diabetes and hypertension.
Do you have drug or food allergies?
No, I don't have.
May I have your physical examination? With your physical examination result, the doctor suspects that you are a renal calculi. So would like the patient to wait for examination. At a hospital in urology surgical ward, Mrs. Wendy Sansuk laid in bed with a tired and fatigue.
Good morning, I'm Lisa. I'm a nurse at the urology surgical ward. What is your name?
Good morning, I'm Randy Sansuk.
Please let me draw your blood for examination and give you 0.9% normal saline, 1000 mm for your left arm.
Yes, I'm well.
Please let me collect your urine for examination. You should urinate a little before and collect urine.
Yes, I will follow the words you recommend.
Mrs. Wendy Sansuk, I will take you to a special radio test around 10 o'clock next day. Please avoid from drinking water and eating after midnight onwards. I will give laxative.
I will follow the words you recommend.
You don't worry. After the examination is complete, allow you to drink lots of water because the chemicals are excreted through the urine.
Thank you.
The collecting blood to be sent to the laboratory. Hello, Mrs. Wendy Sansuk. From the result of the examination of the right ureteral calculi, size 5 mm. You don't worry. We will treat you with surgery.
Thank you, doctor.
Mrs. Wendy Sansuk, doctor diagnosed the right ureteral calculi, size 5 mm. The doctor had pain with ureterolinolithorapaxy.
Hello, I'm
What
Anna.
will happen
Today,
if I
we'll
follow
teach
the
post-op
instructions?
practice, prevent complications, and relieve pain. The practice when returning from the operating room. 1. Deep breathing exercise. 2. The half cocking technique.
Thank you very much for the information and I will follow the words you recommend.
At urology surgical ward.
Hello, I'm Bella. I'm a registered nurse at urology surgical ward. I'm from the night shift.
Hello, I'm Lisa. I'm a registered nurse at urology surgical ward. I'm from the night shift.
Hello, I'm Anna. I'm a registered nurse at urology surgical ward. I'm from the morning shift.
Today I will report the current symptoms of the patients for wards from the night shift to the morning shift.
Okay, I'm waiting to listen.
I am reporting about Mrs. Wendy Sansuk, base 13, age 65 years old, admit to the hospital 22nd May 2020, first diagnosis renal calculi, last disease diagnosis right ureteral calculi, surgery right ureterolinolithorapaxy on 25th May 2020. Chief complaints. Patient come with symptoms of difficulty passing urine, but in the urine, nausea, vomiting, and not efficient for 2 days. Present illness 1 week before coming to the hospital. Patient have occasional back pain and crack in her legs. Difficulty passing urine, nausea, vomiting, but in the urine, and not efficient for today. Past history, hypertension, diabetes.
What problems do patients have now?
Patient has pain score 8. It is by comfortable sleeping position with a head elevation of 30 degrees. Teeth, coughing, sneezing, movement. Recommend relaxation technique to distract from pain, such as meditation, breathing, reading, listening to music. Give pain medication according to the treatment plan, and observe the complication of the drug of morphine 3 mg. Give IV when pain every 4 hours. Paracetamol 500 mg, 1 tab when pain every 6 hours. The patient has reduced pain and has a better face. Pain score 3. Intake 1000 ml. Output 800 ml. Faded red urine.
What are the problems that you would like me to take care of?
I recommend to continue to take care of the patient's pain because the patient still complain about pain score 3. Take care CBI of circular, record urine, and prevent blockage of the CBI cable. If the urine isn't red, follow catheter and discharge planning.
I would like to repeat it again. Mrs. Vandi Sansuk. Diagnosis: right ureteral calculi. Surgery: right ureteral rhinolithotrapsy on 25 May 2020. Currently, this patient have pain problems. I will take care of the patient's problems after you.
I would like to end the shift just did. Thank you.
Hello, I'm Anna. Today doctor has allowed you to return home at 4 p.m. and I will give you knowledge about practice when at home to prevent recurrence.
What should I do?
Drink 8 glasses of water per day. You should try to limit or avoid beef, poultry, fish, pork, spinach, chocolate, coffee, beets, peanuts, soy products, and foods notorious for being high sodium.
Thank you.
On the 1st June 2020, an appointment was made for urinary calculi and go to check with the doctor at the OPD ward.
I will see doctor at the appointment.
Conclude 1. General information ward, urology surgical ward. Age 65 years old. Sex female. Admit to the hospital 22 May 2020. First diagnosis renal calculi. Last diagnosis right ureteral calculi. Surgery right ureteral on 25 May 2020. 2. Unit information. Chief complaint. Patient come with symptoms of difficulty passing urine, but in the urine, nausea and vomiting, and not equation for 2 days. Recent illness. 1 week before coming to the hospital, patient have occasional back pain and crack in her legs, difficulty passing urine, nausea and vomiting, but in the urine and not equation for 2 days. Past history, hypertension, diabetes, treatment received. Doctor diagnosis, the right ureteral calculi, size 5 mm. The doctor will perform the treatment by doing ureteral lithotrapsy. Nursing procedure 1. Puncture but and provide an intravenous solution. 2. Urine correction. 3. Prepare the patient before the special radiographic examination. Health education. 1. Deep breathing exercise technique. 2. The half coaching technique. 3. Prevent urinary calculi.